KM is a 3-year-old little girl who has Chiari malformation and autism spectrum disorder. She came to us for the second time last Wednesday following our initial evaluation of her, and she was excited to play with us again today, or that day. And she did a lot better with her jumping than she did last time. She was more focused and really enjoyed the exercises that we gave her. And we wanted to focus though on her core strengthening, proper gait and stair mechanics, overall strengthening of her body. And so we did an obstacle course, and we worked on stairs, throwing a ball overhand, and prone on scooter with reaching, and then also ball stabilization with forward reaching to play with some toys in front of her.
Okay, yeah, so like Allie said, our areas to continue to focus on to just include our patient's overall hypotonia throughout the body, specifically that core, gait impairments, and then stair ascending and descending. So our first intervention was focused on that core strengthening, which was done by placing our patient prone on a ball, and then we had her reach at toys and like pick up toys while she was on the ball, which she really likes. And she did this much better this week as opposed to the first week when we did it, but we just think that comes with that motor learning. So that looked a lot better, and she didn't try to use her legs to compensate as much for that core. And so this was where we had one of our goals. So exercises like this will help our patient reach the goal we set for her, which involves increasing her core strength to 5 out of 5, which will help to increase her everyday functioning and allow her to participate in more types of play with her peers. We then assess gait through the use of an obstacle course, and patient was able to complete the obstacle course a numerous amounts of times throughout the therapy session. She had that flat-footed gait throughout, so use of heel strike was encouraged through ramps and stepping up onto high platforms. And then patient was taken into another room to work on that ascending and descending of stairs. When asked to complete the task, she was able to ascend and descend the stairs without the use of a handrail, marking time. So then we encouraged her to alternate feet when going up and down. This was difficult for her, but she was willing to try. The stairs appeared to be too tall for her to use the alternating feet, so use of smaller steps should be used in our future therapy sessions to encourage the use of going every other foot instead of marking time. And then this is where our second goal was, so more practice with exercises like this will help our patient to meet another one of the goals we set for her, which was focus on becoming proficient and ascending and descending those stairs without the use of a handrail and alternating feet. This will increase her safety when ambulating at home and while out in the community.
All right, so what we're going to do different next time. I think for the most part, our lab experience went pretty well. Our group works together really well, and we had no problem interacting with our patient. She's pretty easy to get along with. We were able to provide all the treatment interventions that we planned on, and we still were able to maintain a playful and fun environment for our patient. Last week, our main problem was too many toys. It was trying to keep her paying attention because she kind of got overstimulated. So this time, we only used toys and equipment that was necessary for the interventions we were trying to do. So I guess in terms of what we would do differently next time, I would say there's not a ton of things. One thing we thought about was paying more attention to our patient's energy level and restructuring the order of our treatment plan as needed. So this time we started off by having our patient run through an obstacle course that we made to work on gait and problem solving, stuff like that. We did that, and she did a good job on it, but she wanted to keep doing it over and over again, like this probably 10 times. And she had a lot of fun, but you could tell that towards the end she was getting kind of tired. And like from a time standpoint, it was fine that she did it a bunch of times, but we didn't really realize how tired she was getting. So when we were doing our other interventions towards the end, she still tried hard, but you can tell she was kind of getting tired and was wanting to just like lay down and be done running around and entertaining us. So I think next time we will be more focused on making sure we get all our interventions done, and then if we have time at the end, go back and doing things that she was having fun with, just to make sure we hit all our bases in that regard. So I think that is it for what we do next time.